I'm Amber Bell, and this is Real Agriculture. I'm at the Crossroads Crop Conference today in Edmonton, and speaking with Kim Ruether of Project Brock Society. So welcome, Kim. It's great to see you.
Thank you. Thank you for hosting me here.
So you just got finished speaking about a tragic loss in your own family, and we're going to be speaking a little bit about some of that kind of on-farm safety.
Yes.
And some of the problems around it. So can you speak a little bit about Brock and why you do this?
So I had 4 kids in 5 years, and Brock was our third child, and he went to practice at his volleyball practice and collapsed and died of cardiac arrest. And tragically, although an AED was available at the gym doors at the school, they got it, put it beside him, but never used it. So after Brock died, I decided that it would be great to start raising awareness around AEDs, CPR, the need for increasing resources and making it so that we could have some saves rather than just funerals.
Right, because in your presentation you were mentioning that if you can get that AED out immediately or pretty soon to immediately, it can save a lot of lives, right? Can you speak into that a little bit?
Absolutely. So right now our survival rate is 10% or less. And so if we could get more people acting rapidly with their hands on the chest, doing good CPR and using an AED, we could increase survival rates. There's been some areas that have brought survival rates up to 45 or 50%. So it all is dependent on making sure that your bystanders are educated and that they have the tools available.
Right, which is really difficult, especially in farming communities. And so Brock was in school. How old was he?
He was 16.
16 years old.
Yeah.
And I think that's kind of one of the misunderstandings we have too, is that you think that it's going to happen to older people, right?
Absolutely. Mm-hmm. And I think that that's where, you know, we should look at making sure that we're recognizing that sudden cardiac arrest can happen at any age. And that if we started training our kids in schools, having medical emergency drills like fire drills or lockdown drills, then we could have a whole citizenry trained to do CPR and apply an AED or do any of the first response tasks, you know, to any medical emergency really quickly.
So getting into schools is a really big thing. What do you see that looking like? Because I know that's something that you've worked hard to put information out there. How do you see that getting into the rural communities a little bit more and into the schools?
You know what? I think that right now the Heart and Stroke has created cardiac crash, and so it's actually a video-based learning model for teachers to use for students in their classes to do the training. And it's super, super simple. They just need the equipment. And the students just follow along with the video, and it's like competition based. So there you got 2 teams, you know, competing with each other, learning all the skills, learning about AEDs. And so if we could have kids trained in schools with that program, it would be super easy to have teachers facilitating it and educating our kids. We did it from grades 4 all the way through grades 12. And it was fantastic. The kids loved it.
Right. I think that's a really interesting perspective and a good way to get that information out, because some things are going to be really hard to change.
Yeah.
Right. We have emergency response times in rural Alberta, Canada, probably rural everywhere.
Yes.
Let's be real.
Yes.
That are slow.
Yes.
So that's a really interesting perspective. Do you see any other places that we could use some policy changes maybe to be able to help in emergencies?
You know what? I think, yeah, because there's definitely healthcare disparities when it comes to rural. So I think that we need to have a marriage between our health and education silos. Like, they have to be married together so that we're getting healthcare people. Like, for example, first responders are in every little tiny community. If we could get them involved in schools, teaching like skills, like EpiPens and stop the bleed kits, and like there's a lot of different things that we could do. And we need to have like first response teams in our small communities so that we have people that are trained or have a AED available, because typically an ambulance, I know up by my dad, can be half an hour to an hour. Like, there's huge time issues with having any sort of medical teams arrive on scene. So having more of our kids and citizens and farmers trained would be hugely beneficial. And I think that we need to make it so that AEDs are a mandatory part of every school. They should be legislated.
Right.
And we have to change our laws so that we are training our kids to, you know, have to have CPR training or kind
some
of
basic first aid.
Yes. Like, I think that that's a really important part of it as well.
And what have you seen as a response since you started Project Rock?
You know what, there's a real enthusiasm for teachers and students, and people are excited about the thought of doing it, but finding the time and the resources is really difficult. So we just need to coordinate everything together and get it happening. And I find even when I'm speaking with legislators, there's so many competing priorities, but we need to focus in on, these are lives lost.
Right.
So it's important.
Right. It really is. Well, I want to thank you so much for your time and for your presentation. I think it really spoke to a lot of people that were in the room. I know it spoke to me. So
thank you.
Thank you for the work that you do. And that was Kim Ruether on Real Agriculture.